What's up, y'all? Welcome back for another episode of the Sweet Tea Dialogues. My name is Portia Bimbo. I am the founder of Diabetes and the Odds. And with me today, I have some amazing women living with type 1 diabetes. And we're here to talk about the intersection of womanhood and diabetes in honor of Women's History Month. So, ladies, are you ready?
Yes.
Awesome. I'm going to start to my left. Would you please introduce yourself? Tell us how long you've had diabetes and what roles you play as a woman.
Yeah, so my name is Keneya. I've been a type 1 diabetic for 24 years as of last month, and I am a woman first, black woman at that. But I am a daughter, sister, wife, granddaughter, niece. The list goes on. I'm a lot of amazing things. But yes, at the start of all that, I am a black woman who is killing it with diabetes. Period.
There we go. Hello, my name is Toya. I am 4 years diagnosed as a type 1 diabetic. Like my colleague said, I am a black woman first, and I'm also a mother. And I'm not going to go down the list about a grandmother and all this stuff. But, yeah, that's me.
Okay. Hi, my name is Tiara. I am a type 1 diabetic, and I was diagnosed when I was 9, so that's 18 years now. 18 years as a type 1. And I'm literally just a girl. So with, pancreas issues. But that's about it.
And I wrap us all up, type 1 diabetic. I guess I'm the OG of the group. I seem to always be the OG of the group, unless I'm with Sugar Jerry. Shout out to Sugar Jerry.
Hey.
But type 1 diabetic since I was 11. So 26 years next month, April 12th. So we all talked about the different kind of roles that we play as women. And so what do you all think is one of the most overlooked aspects of being a woman living with diabetes, like managing that on top of all the things?
Well, I think for me, one of Portia events stood out to me when we did the jump, what was it?
The trampoline
class. And it was one portion where we had the balloons, and she says she wants you to hold the balloon or bounce the balloon up. You have to throw it up in the air while on the trampoline. And I feel like that really resonates with being a woman with diabetes. Not only you have to take care of yourself, mental health, your family, you have to take care of just a womanhood, just keeping up everything on top of blood sugars, on top of periods, on top of being a mom. So I think that was the best visual way to kind of represent throwing up a balloon while on the trampoline. That's what it's like, trying to juggle all of it at once.
That's so hilarious that you talk about cycles because it's you're already supposed to be emotional when you have a cycle, but then you add diabetes and you add a high blood sugar or a low blood sugar, and it's it could be one or the other, or it could be both at the same time, right? So just give me a little grace, cause
I think for me it's actually interesting that we brought up cycles already because so the day I was diagnosed, I actually started my cycle for the first time. So I felt like I was stepping into womanhood and being a diabetic at the same time. So I was learning how to give a shot and change a pad. Sorry,
at the same time.
This a lot. It's a lot, right?
At 10.
At 10 years old,
Ooh,
so stepping into womanhood, I feel like was a big pivotal point of womanhood is a rite of passage in a lot of places, especially our culture, but kind of stepping into that plus my own journey with diabetes. It was a lot. And I think at 10 years old, especially because when you go back to school, you're trying to explain that, you're trying to understand it yourself, you're trying to navigate it. It's a lot. So I think what's often overlooked is just balancing the emotions that come with it. And people already assume that
women are emotional.
Yeah, that we're emotional already, which is honestly, it's not even a bad thing sometimes because at least I'm in tune with how I'm feeling, how I look at it. But, it's just, how do you navigate all of that when you're trying to find okay, I'm understanding what does womanhood look like for me, right? Because we've seen how that has changed over the years for people, as well as how that diabetes journey looked for me too. So it was very interesting because I had a black woman as my doctor on the day, and she was like, I see a little sugar, but I also see a little blood. And I was like, girl, this is too much. It's a lot. And I'm in there with my dad and my brother. I'm like, y'all don't understand.
Oh, my goodness. That would
yeah.
So, Toya, you're a mom.
Yes.
And I mean, you could be any gender parent and have diabetes, but let's talk about the role of being a mom and then having to take care of other people, but then also having to take care of yourself?
It is definitely a lot of balance that comes into play. First, I have to make sure I stay on top of my diet as much as possible, because I can easily be a low, but I always call myself a functioning high, because I don't have time, because I'm always taking care of other people. Mm-hmm. But having my boys and then being like newly diagnosed with the fluctuations and like the emotions and everything, and trying to figure out what is this feeling that's happening. Just teaching them that, like, okay, this is how you give mommy, like, check mommy sugars and stuff like that to make sure I'm okay. But it's been interesting, to say the least. Definitely a handful.
Yeah. I think it could be a lot when you're trying to be a mom, a wife, or a partner. Then you got your work life. You got to be a professional too. And then you want to be sane. So then you got your hobbies that you want to keep up with too. And it's like, you know.
Or even if it's like
stuff go.
Yeah.
Like, it's too much. Yeah. But like how she touched on earlier, the mental health aspect, it just plays a big role, because a lot of times, if you, like, I guess we know what we're supposed to do, but in reality, it's really hard to do it all. And then you start feeling guilty that you didn't do it, and it's just like,
I can touch on that.
Cycle.
I can touch on that, but for me, it's not really taking care of a child. It's taking care of my mother.
Oh, and your mom.
My mom. Actually.
So your dog
is my
you
baby.
love that dog.
Dogs know too.
On a different note, like my mom is a breast, brain, and spine cancer survivor. It recently came back this January, so I haven't really expressed it on any of my socials or anything. But my day is taking care of her and myself. So that may be taking her to 2 different treatments in one day all by myself, while still working my 2 jobs now, almost 3, from home, and then being a diabetic on top of that. So, again, I don't show it, I don't post it, but that is another part of it. There's been many times where I'm like, oh, dang, I'm low, but I got to make sure she gets in, get her appointment first, sit down before I drink a juice. Yeah. So sometimes you do have to put yourself in the back burner, but you got to have priorities, and that's my main priority.
Yeah, it's crazy how many people don't know what's going on behind the scenes,
Yep.
right?
Yeah.
Because I know, like, I guess people sometimes expect, like, for social media to show it all, but it's curated, right? We choose what we put on there, but there's so much that happens behind the scenes. And even if we do share it, it still doesn't really show the extent of what we're doing, what we're dealing with as women and women with diabetes. So it doesn't surprise me, like, because we all have, like, things that we're doing behind the scenes. And that's a lot to be a superhuman for yourself and then for your mom too, right?
Yeah.
So yeah, it's just amazing how much, like, we show to the world versus, like, how much we're dealing with in here, up here, to try to balance it all.
It's just the tip of the iceberg online.
Yeah.
And then as Black women, we are taught that we are, strong. We can handle any and everything. So how does that play into how you manage all these roles and responsibilities and how you deal with everything?
Definitely, for me, the psyche of it all with the strong Black woman phenomenon. Yeah. Just like, okay, girl, you tired, but you got to get up.
You got to do this.
Because if you don't do it, you don't have nobody to fall back on. You have to do it. So it's like always me pushing myself to do it and make sure that regardless of what's going on and how I feel, no matter how fatigued I am, I have to get it done. Yeah.
I think for me, a caveat is actually a little bit the opposite. So, like, for me, I don't like when people tell me I need to be strong, or, like, that's actually more pressure for me. I like when I go to my friends and they give me grace. And they're like, it's okay to not be okay. Because I'm going to try to be strong no matter what. Yeah. But it's nice when you got people that's like, it's okay to not be okay. Especially as a Black woman, because everyone feels like we're going to handle it all by ourselves, all our own. But that's still more pressure on my shoulder. I'm going to do it, yes. But what makes me feel better is actually the people around me telling me, like, it's okay if you don't get it all together. Yeah. And then it just makes me want to go harder, because that means someone understands if I'm not perfect.
Yeah, I think, it's definitely a very personal thing too. I agree. Like, it took me a while to find spaces, and I even still get acclimated to finding spaces and being open in certain spaces, or just being open with this, right? Because, like, there's not too many people in my life outside of the community that, like, we built that, like, really understand what it's like to be diabetic. So you may open up about something and people just don't understand it, and you're like, okay, I'm having a low, here's what happened. Well, why didn't you do this, or why didn't you do that? And it's like, please don't criticize me. Like, I just need to, like, I'm dealing with this, right? Or even doctors. Like, there have been some doctors that, as much as they should be your your caretakers and your, the ones that support you,
Yeah.
sometimes they don't understand.
Yeah.
And like, it's really hard when, I don't know. I've realized that like a lot of people, when they try to, and they're trying to support you, but like sometimes it does feel like you're being penalized. Or it's like, well, why didn't you do this? And it's like, well, I'm struggling too, and it's okay. Like I need to be able to say like I'm struggling. Like I've had this for a while. There's still things that I'm navigating with this, right? Like, and as life, especially now that I go from, like I just said, that young girl who was starting her cycle at day one to now being a wife who wants to one day be a mother. Like there's just a lot that comes with that. To being, when I was in my 20s, the girl who wanted to be out and having fun at the party, but also like, let me check my blood sugar on the side, right? Like, you want a shot? I might. What am I looking like, right? So like, I think there is a lot that comes with this in terms of like being open in the space, how we're evolving, finding those spaces, and being able to be vulnerable, but also having like people in our lives, such as like that we trust, like whether it be family, whether it be doctors, who sometimes can be very critical of you, and they don't understand. Like even when I remember when I went to a doctor, I was struggling, and I was like saying, how do I deal with this? And his response was, just punch the kids. And I was like, bro, that's not help. I mean, I want to punch you right now. Like, this is the best you got. Like, you my doctor. We changed, but like, that kind of stuff. So yeah, it's
on that position though. I'm probably gonna get chewed out, but I am definitely leaning towards not going or seeing an endocrinologist for a minute, because I feel like every time I go in there, I'm trying my best in my regular 9-to-5 everyday life. I'm really trying my best to stay between those lines. But every time I have any kind of high or I dip low, it's like chastisement. And I'm just like, I don't want to go in there no more, because I feel like you making me feel like I'm doing it wrong, or I'm messing up, or I'm not.
And you have no idea. Like some of them have no idea. And I was like, even a diabetic I had one time, I was like, you have diabetes. You know how hard this is. You should understand. But it's like,
question for y'all. I've never had that experience with my endocrinologist. I love her. Like, she gives me grace.
Keep her.
She gives me grace. So I'm just gonna say, maybe if y'all been with them for a long time, or was it like short intervals? Because both. Like for me, this has been my doc. Like we're connected. So she's seen me when it was a bit high, way back in the day, and even now it's like she'll be like, But I take accountability when I go in the office.
Yeah.
I'm like, I already know I should have did this. I should have did that. And she's like, yeah, you're right. Well, how you feeling? I was like, yeah. So I'm like, I hear stories of this, and I feel for you, because I think that will make me way more on edge if my endo was on me as that hard as I'm on myself.
I've had different experiences with endos. When I was younger, I had a white male, didn't have a great experience. He did not want me to get an insulin pump until my sugars were controlled. And I'm like, this is the very thing that's going to help me get my sugars under control. So we switched doctors. Then I had a black female endo. She was my, shout out to Dr. Lowry. I don't know where you are, but I miss you and I love you. By far, loved her to death. And then now I have another female endocrinologist, and I love her too, right? But at this point, I've had it for 20 plus years. So it's like, it's not much she can tell me. You know what I mean? I'm just going to check in.
And refill my prescription.
Refill my prescription. So it's like, and I know for the most part what I did not do, what I could have been doing, what I'm going to work on when I leave her. Right. So maybe that's the thing too, because you're still kind of new to it. You know what I mean? Like you still got to, not saying we got to figure it out, because we don't.
Yeah. We don't.
But it's a certain level of, it's nothing you could tell me at this point. Like, I already know what I should be doing. You know what I mean? Well, except when I get pregnant, then that'll be a different, different situation. But, so.
I guess, I won't discredit nobody. Not Piedmont, but it's another facility. I'm like, stay away. But it's interesting, though, because we've had it so long, I've had a number of endos, too. I mean, I've moved a lot as well, too. I've lived in about 4 or 5 different states. And so I've had to find different endos there, too. So my favorite was a woman who was in North Carolina. I had some, I don't even remember everyone's name. Like, it's been that many. But I also stayed with some for a while, and I was definitely younger. And I remember vividly when I was around 13 or 14 years old, and I was struggling with my A1Cs. They were double digits. We're not going to say the number. They were just double digits.
No shame.
I don't even remember. I just know they were double digits. Maybe 13, 11. Who knows? But I remember when I was 13 years old, I think my mom stepped out, and the doctor said to me, unprompted, well, you can have unplanned pregnancies. I was like, are we here to talk about what I'm not doing or like what I actually am worried about right now? But it wasn't even a conversation around like sexual health, sexual history, but she felt the need to tell me that like, as a diabetic, you can't have unplanned pregnancies at 13 years old, young age. Some may say, oh, she was looking out, but some may say like, why did she feel the need to say that? Was there some race tied to that discrimination? Maybe, in my opinion, because it was unprompted and it was nowhere near the conversation. But just as a woman, like at a very early age, then I had in my mind around like even my own sexual health or understanding that like, okay, Keneya, like a fear of like, okay, you can never, like you can't get pregnant. You can't, like you have to like, so how I approached it for a very long time, like everyone should be thoughtful around pregnancy in some manner, right? But just the way I even thought about it or approached it or even approached sex, like that stood with me because it was like, she tried to scare me instead of having a conversation.
Yeah, she should have read the room. Like you read the room and you don't have that conversation without the child's parent right there.
And my mom left.
And she walked out. And you can be like, okay, Mom, is it okay for me to mention sexual health with your daughter in the room?
Yeah.
And now you're basically traumatized. And that's kind of how you went into being a woman, being traumatized. And it's hard to speak from someone else's point of view who's not here, right? So we have to give her grace there. But at the exact same time, she may have been wanting to come. She may have just had 5 other patients come in pregnant that day. I can't let this girl go without me telling her. We don't know what she was going through mentally, but she has to realize you're in that field. Your voice matters to us.
Yeah, very impressionable.
And you can't be saying this without my mama right there, because I'm gonna tell her as soon as we walk back in this room. Mama, she told me this.
Yes.
And now I'm going into this sexual hood completely scared, and especially about something like that we haven't even experienced yet. Like,
and to be very honest, like granted, I came from a household, thankfully, where we were, we had open conversations, but I hadn't even gone through that in school yet. So like, she was introducing me to something I was like, I haven't had relationships. I haven't like, so it was a you're putting a fear in my mind, and I would say I'd be lying if I didn't say that in different like moments of my life of womanhood, I've led with some level of fear, but it started with like an impression of fear. So even with like pregnancy, there's a fear there, there's a risk there, because she opened up with all the risk of being pregnant. So now as an adult who is thinking about it, I'm like, I'm scared. Like, you can be a little scared about the idea of being pregnant to a point where I've had to talk to women who are diabetics, and they had to reassure me, you can have a child.
That was the only time,
Like, it's okay. You will survive. Look at me. But it's like, it all started with fear. And I actually brought that into some relationships. And had to have some conversation with people. Like, shout out to my cousin Kiana. She was like, you can't lead with that in conversation because it can scare men because you're bringing that fear in that conversation because of things that started at and you don't even realize, like, it wasn't until I got older, I was like, where's this coming from?
That lady.
Dr. McGrath.
Yes,
I didn't even say the first name. I could throw it all out there because I remember her name. I don't know everybody else's name, but I remember her name.
So, Keneya, you bring up a good point around, dating and diabetes and, maybe getting pregnant and diabetes or being pregnant while having diabetes. But I'm going to toss the question to you, Tiara. Keneya's married. I'm married. You're dating. How do you navigate this dating and diabetes thing?
If I'm transparent, it goes back to me when I was a kid. If I'm being honest with you, I was like in high school. My mom dropped me off at a party, and it was like some really good looking guys there. I'm not gonna lie, they were just so cute and good looking. But I'm not really the shy type, but a guy has to come up and talk to me first, just to be transparent. So I ain't talked to him. I was just looking at him. But when I sat down on the couch, I had to do a shot. So I did it, and I did it in my stomach or whatever. And this was I guess he was attracted to this because he was like, oh, you do that? Oh, you not scared? And I was like, no, I'm not scared. So I don't know. I have to bring it back to that moment. It's just being yourself. Even when the Dexcom is going off, it's just being yourself. Like, even now, like, if that goes off and I'm on a date, like, a guy just asked, like, what is that? Is that a ringer? And it's just me being honest and transparent when I date. Like, I am the diabetes that I have is with me. You know what I mean? Not a part of me. Like, you're gonna see this needle. You're going to see my phone out on dates, and I'll explain why. Because I don't like when people have their phone out on dates, if I'm being transparent.
Same.
But I'll explain why. Like, look, I want to make sure I can see my blood sugar.
Yeah.
Like, a guy I dated one time brought it up, like, why you had your phone out? Look, you want to see?
Yeah.
I ain't texting nobody
We
on
can
my
see.
damn phone. But I think it starts with, if I'm honest, back to even then, it was that moment when I was at that party and I realized, oh, somebody can like me while just doing a shot. And that's, and I think a lot of people don't always have that experience. So coming into it, you may want to be a bit more shy when you're coming out. But I had someone actually like me because I was a diabetic. So I don't know. I think it's just ever since then, when I date, you're going to know the first date I'm a diabetic. You're going to see the shot. I'm going to ask you, do you want to give me a shot too? I'm not even lying.
Ooh.
Oh, yeah, I do that.
I've done it so many times,
Yeah. I think how somebody responds and leans in matters, though, because I agree with you. I've always led with being, like, open. It's not, I mean, I'm not going to say, hi, I'm Keneya the diabetic. Like, I'm not going to be that person. But, you know, I'm also not going to be so shy about it. However, I was different because for a long time when I was especially on shots, I would do shots on the table. So my now husband was like, why are you doing that on the table? Bring that up. And I was like, say less, baby. You know what I mean? But I've also dated some guys who were like, okay, and just like turned over, or like didn't want to engage, or like didn't want to like, really be, I don't want to say into it, but they didn't really take initiative to like know what that means for me. They kind of like, okay, that's your thing. Like when you're done with that, you can come back. And I was like, I didn't even know when I was younger how much that mattered, because I was like, you're right, this is my thing. Like I got this. But now that I have like a partner who was like, what you need, or I already got this, or I thought about this, or, help me under, like I was sharing the Dexcom app. Okay, what does it mean? What am I looking for as you share with me, right? Like you actually care and want to know what it's about. So I agree with you. Like being honest is important, but also how someone shows up in that honesty and accepts that. I think it's also important.
But I have to say, you do have to have boundaries. Like, so I started dating one guy who wanted to see my numbers, so I shared my Dexcom with him. So, which I thought was real cute. You want to see, you want to check up on me. But you got to have those boundaries too, because like he would call me saying, "Oh, you're low," but like don't yell at me telling me I'm low. Do not yell at me. That doesn't help. You can say, "Baby, hey, how are you?"
Yeah.
You're a little bit low right now. You know what I mean? I'm not home right now. It's a way you approach it, but I think you have to have those boundaries, because sometimes you can scare the other person, and you don't even realize you're scared yourself. Like that's why you bring it up in conversations. That's why you mention your fears, because you're scared too, but you're telling to someone who don't even know what it's like, so they're even more scared. So you I think it's good to have groups like this, because you kind of forget how important it is to not put too much pressure on the other person as well to take care of you. You have to be independent, but we also want somebody to lean on.
This sisterhood is definitely working dynamics for me, because even though I'm the youngest and the newly diagnosed in this group right now, I am also recently divorced. So understanding what it's like to put myself out there and at what point do I disclose, because like how you were saying in the beginning, you was doing your shots under the table. I wear my Omnipod like in discreet places, because I don't know if I want to talk about it. I know he probably going to take me out to eat, so I need a bolus real quick, like discreetly. But at the same time, depending on where I go, if I know like my Omnipod going to die at 7 o'clock, I don't know if y'all know, but when the Omnipod dies, it flatlines. It's like...
It makes the noise?
Yes, it does.
I heard about that.
Yes, it does. And so sometimes, depending on if I'm with my homegirls or whatever and it dies, then I'll be like, all right, y'all, around 7 o'clock, y'all already know the flatline will come up. But if I'm on a date and it flatline because I forgot, because I was in so much like preparation mode, I would like be so embarrassed. Yeah. But going back to my point, just like not knowing, and then touching on what you said, like, at what point do I disclose, and then how much, and then it's just a whole thing. But I haven't started dating because there's just a lot.
Yeah.
But I wanted to say something about that, because it's like you want to tell them immediately, but I think there's this fear of, will this person love me, like me, with all of the things that I have going on, right? Like,
But I think you gotta tie in somewhere that this is me.
correct, but once you get there,
Once you get there, but
when you're
before
not
you get there,
it takes a while. Some people are like that initially, and then some people are not. I was not, and so no, I'm like, this is me. This you get what you get. Obviously, I'm married now, 8 years, but God forbid anything happened. If I was a date, news, like, this is me,
Right.
But when you're not that confident or secure, it was very much so. I'm off to the side. Even with my friends, I didn't even do it in front of my friends like that. Like, they all knew, but you would be surprised how many people tell me, you had diabetes this whole time I knew. Yeah, this whole time. Middle school, high school, college, the entire time.
Same.
But I was not,
Well, I think it's also important. Like, do I even like you? Because I'm gonna be honest. I'm also not gonna put a lot out there if I don't even like you yet. Because I'm not about to.
That's true.
So I will say, if you are like filling
If
it
you're
out,
not
like, if I don't even
attracted,
know if I
yes,
like you
no.
yet, so I'm not gonna bring you into this. Like, let me just wait until, like, right now we just at you cute, I'm cute. We this is where we at, right? Like, once we get further, then I can decide to bring you
but
in.
that alarm
might
could go
take it
off
a little
at
deeper
the
with
end
the
of beginning.
conversation. If you feel like you vibing with this person and you ready to take it to the next step where you taking your clothes off, I'm taking mine off. Like,
You got to talk
do
about
you
it.
say it
Yeah,
before?
but-
Or do you be like,
Yeah.
you mind? Like, what do you do?
So
You
I
know
will
what
say
happens.
this. I will say this. So before clothes come off, because it's kind of hard to miss if you wearing stuff.
Right, the game
Come on,
is like,
Joe.
okay, wait, hold on.
Because
About that.
I will say this: when I first started dating, I was still doing like glucose monitors and shots. So unless I pull something out, unless I
Yeah, so you want to really visually see.
unless I like put out a device, then you wouldn't know. But I
make it
think
better.
what's really important, I had to pause. I ain't pulling stuff out like that, but I had to.
That's how she
Womanhood.
got that ring.
No, not that. Okay. Y'all got a lot of things I want to say in that moment. We're gonna keep it clean. All right. So, but I will say that as long as you don't project your fears or if you're feeling kind of insecurities onto that person, as Tiara was saying, I think whenever you decide to have that conversation, that's my only bit of insight that I would offer is that because you're having a conversation around something that can be very personal to you, right? We know it's very personal to us. And as you said, or as we've all said, it kind of comes with its own stigmas, fears, things like that. But how I present that is also important because to your point, this person, this may be their first time having to experience someone with diabetes. So I can either communicate it from a place of like, this is the worst thing ever. It's so much. I got to do this. Because now they're like, oh, if I'm with that person, this is going to be a lot. Like, you know what I'm saying? Versus like, how do I kind of ease someone into who may not be familiar in a way where I'm not projecting my fears onto them to now I'm creating fears for them because that happened to me.
Yeah.
That happened to me actually in a relationship where I was projecting my fears and I was called out on it, not by the person or someone else because I had to, share like, oh, what's going on? But I had to like realize like, oh, wait, the way I presented this, you're right. And it was around the pregnancy topic, which is a whole other layer.
Yeah.
Right. But I have fears around that because we know about the doctor, right, at this point and where those came from. So, I had these fears, but I led very much fearsome. Like, I don't know if I'll be able to have. And if I don't have, and like, what are the options if we don't? And he's like, we just now talking about. Now he's fearful, like, will I ever have a family? Like that kind of stuff, right?
I think if I could give anyone advice on that, it's just to go slow with it. So, like, go on the date, right? Get dressed, get cute. And then if you drop and it goes off on your phone, then explain. Like, you don't have to, like, prepare at home, like, oh, I'm going to have a conversation like this. Because you know it's going to go off at least once. Bring it up then. Oh, this is my alarm. Alarm for what? Diabetes. Oh, I got you. You want to talk about it now or after a drink? Like, I'll crack in a little joke here and there. You know what I mean? I just try to ease it in as much as possible. And then until someone asks me, like, do you have fears or something? That's when you're trying to get to know me. Like, oh, okay, well, now I'll tell you a little bit more. Yeah, to be honest, I'm a little scared. I got a little fears. But that means that's a man that's taking charge. And that's a man that wants to know if he can step in. Yeah. But again, I don't lead with that. Like, he going to have to piece that out of me if he really want to get to know me.
I feel you on that.
But I feel like your question could have been like, what if it's a casual experience, right? And it's like,
Oh, what if it's casual?
what if it's like,
if it's casual, don't be asking me no questions because
but I mean, but okay,
But I don't want to
like,
get there and then they be like,
casual,
you know.
But it still
Because
works.
this what it
Everything
is.
else still works. The things that matter to you still work. So why are you
Right.
asking me questions?
No,
It's
but
casual.
but I
Some
get
people
stupid
might be
stuff.
scared to touch it, like hurt
I
it,
get
make it
that.
fall off,
Yes.
and all this other stuff.
Yeah,
but
but
I
I
just-
touch you.
I'll be
Can I please
transparent.
just say, are you gonna
You can
pass out?
still
I'm like,
do what you got to do.
you got to ruin the whole like.
You asking
But you
questions
gotta-
at the wrong
you gotta at
time,
least
like,
have juice by the
maybe that
bed.
answer.
You,
Wait a minute.
You gotta at least have juice by the bed. You may not want to tell him everything else. Just say, hey, I gotta stop and drink this juice.
Yeah.
And I'll be back in about
I
juice in your
can't.
fridge.
And I have juice by the bed.
I would literally have juices in my bag if I'm going over somewhere, just in case they don't have anything in their fridge.
Oh my lord.
I
gotta
am
be
married
prepared.
and I still have juice by the bed. I always keep juice by the
always
bed.
keep juice by the
So,
bed. That's the
yes,
dating 101. Keep juice by the bed.
Yes,
Juice by the bed.
you gotta
Gotcha,
keep some
okay.
juice.
Noted.
Yeah,
Duly
I mean,
noted.
if they call it out, then sure, but
Yeah.
let it be there. You know what I'm saying? Like, don't make a thing out
They
of it.
gonna
like,
call it out
because
at that
honestly,
moment.
if you make it, a thing, yeah.
Not after.
So if you're like,
they
okay,
say
be
that.
careful now, because I may have something right here. So
Uh-oh.
then it's like, okay,
Not
hold
in
on, wait,
Atlanta. You don't wanna
'cause
lead
again,
with
you're
that.
leading- but that's another example. You are kind of leading with the insecurity or fear because you're insecure about how that person may respond to now you have a device. You're
Okay.
leading- that's another example of that, right? But it's
Okay.
just like, be
I just,
confident.
like, babe,
okay.
let me unclip this real quick.
Yeah.
So we can. But
Lay
anyways,
down.
okay.
Might drop. That's okay.
So you've been pregnant twice.
Yes.
You did not have diabetes
No.
at the time, but you got it as a result of.
Yes.
So let's talk about that experience.
Oh, okay. So there were, of course, 2 separate occasions because there are 2 different pregnancies, and that they were in 2 different states. So I had 2 different experiences.
Okay.
So the first one, I pretty much failed the sugar test. Like when you go in, if you're, I think at like somewhere between 10 and 18 weeks or something like that. I don't know. But they give you a sugar test. Basically, you drink this little thing of Kool-Aid and you sit there for an hour and it tests to see if your sugar go up or down. First time I passed it. Second time completely failed.
But they chose Kool-Aid of all the drinks.
Look, that's what it tastes like. It tastes like a thick
They make
Robitussin
Kool-Aid at the hospital, the doctor's office.
syrup. It's a syrup, but it tastes like Kool-Aid.
Okay.
And you just got to sit there for like an hour and then see where your sugars are afterwards. If you pass, great. If you fail, they're going to put a sticker on you that says gestational diabetes, and they're going to send you up the lab. So the second time after I took the test with my first pregnancy, I failed. They put the sticker on me that said I'm gestational diabetes. They gave me a pamphlet and said, stay away from sugar. Have a nice day. We'll see you at your next appointment. That was like for, I want to say the second and third trimester. That's all I knew. I'm not supposed to eat in my head because I don't know what they mean by stay away from sugars. I'm thinking no ice cream, no cookies, you know, like what we associate with sweet. I'm not thinking fruits. I'm not thinking about bread, like those type of things that
Acai
turn
bowls
into
that are
sugar.
like
Everything.
75.
Right. So when my
Was it
first
acai
son was
bowls?
born, he ended up being 9 pounds, and then he was in NICU for coming early. Both of my pregnancies were early. But he also had an issue keeping his sugar up and stable for like the first, I want to say 3 days or so. And they was just like, you know, if this don't panel out, we're going to have to do X, Y, Z and put the diabetic sticker on him. And I was just like, but I'm not even a diabetic. Like, how does this work? But by the time my 6-week checkup came, after I had him, I was back to normal. Everything went good. And I think, 2 years later, I got my second pregnancy. And I just disclosed because now the first one was in Tennessee. The second one, now I'm here. I'm a Piedmont. And I was just like, I don't know if this means anything, but the first time this happened, they said something about a gastron diabetes thing. And I just need to let you know that. She was like, oh, well, we're just going to go ahead and put it in your chart. Thank you for telling us. We're going to go ahead and do some early detection screenings. The first time, flying colors, no problem. The second time, the same thing, same, like, I guess, duration or however far along I was in the pregnancy. And it came back that I had gestational diabetes. But this time she was like, okay, it looks like it's here. We're going to sign you up with a dietitian. We're going to go over this. We're going to start you based on this with some, what's it, Glimperide? I think that's what they started first. And then, like, towards the end of that pregnancy, they was like, these pills ain't working, girl. This is too aggressive. And that's when they tried to introduce me to insulin. But before I could give myself the first insulin shot, I ate a pineapple and the baby came. I was like, welp. At that 6 weeks postpartum check-in, again, it's gone. So I'm like, okay, I'm back to doing my own thug thizzle. 3 years later, I'm in Mexico, and boom, I just was like, I feel sick. I don't know what's happening. I passed out, woke up in the hospital, DKA, and it was like, you're a diabetic. I'm like, who?
Oh, what?
Exactly. So, no, I'm not.
It sounds like it was trickling down, kept trickling down, and then it hit you all at once.
Yeah, because I believe if I would have maybe stayed the course with whatever they were trying to prescribe the second pregnancy, then I think I would have been a lot better off. But for them to say, you know, everything back to normal, then sent me on my way, and I go out and I'm just like eating everything that I possibly can, how I want to, with like no dietary restrictions. I think that just put maybe my body over the top. So, but I do think the pregnancies is what initiated all of it. And I think also if I had a better care team the first pregnancy, that the second pregnancy probably wouldn't even have been an issue.
Yeah.
So,
Definitely offering more than a pamphlet would have been helpful.
Yeah.
Yeah.
And it was like one of them dual pamphlets of like English and Spanish. And I was just like,
Yeah.
yeah.
Wow.
It was like
They
one of
give
them
you a
little,
sticker
what'd you call
for
it?
you to go somewhere.
I had Obamacare, so I ain't had a
The
best
for-
treatment
yeah.
plan. Because I had just moved back in the country because that was the whole reason of us. I used to live abroad. And then when I got pregnant over there, I was just like, I don't want to be in a position to where I'm having a baby and I don't even understand the language and what's being said around in my times of stress.
And then
Like,
meanwhile, you got diagnosed in another country with another language. Yeah.
Yes. I was just like, nah, it's too much. Let me come home and have this baby just in case anything goes wrong.
Yeah.
What country were you in?
I was in Dubai.
Oh,
Nice.
take me with you now.
I would love to.
Pregnancy and diabetes is it's an interesting, personal, scary, can be scary topic.
Can I say a disclaimer?
Yeah, go ahead.
For the people, especially the men out there who is possibly talking to somebody who may have diabetes, please stop assuming that the woman is barren because of it. That is not what it means, okay? She could still, as I just explained, she could still have kids. Ain't nothing gonna be wrong with the kids when they grow up. Like, it's not a plague there.
But I think there's,
Oh, my bad.
But that's an interesting point because that's where I was going next, right? Because there are some women that experience infertility as a result of diabetes or other conditions. And so my tip would be, don't even talk about whether you're diabetic or not. Don't ask a woman if she can have kids or if she can't, because you just never know what's going on behind the scenes.
but I will say it's interesting though, because that is, I mean, there are men who, I know men who would say if a woman couldn't have, I was like, what's your red flag? If a woman couldn't have kids, I was like, what if you're married? It'd be over. So for some men, that
It is important
for them.
But
then for
automatically assume that. I think that's ignorant.
But I honestly thought his response was immature, hence why we didn't end up together. Well, one of several. But what I would say is, because I think there's a blend of what you are saying. Yeah. I would assume, right? Like, don't assume either way. Don't assume that a woman can or can't, right? But also be very thoughtful about how you approach the conversation with any woman, right? Because diabetes or not, there are risks that can come with being diabetic, but also just being a Black woman in America, there's so many like risks with, you know, with not only being pregnant, but having a full-term pregnancy and you know, having a healthy delivery. So how you approach that conversation, be thoughtful around that, especially because this is happening to our bodies, right? And so, you know, how you approach that conversation in a way that isn't triggering or fearful or, you know, concerning, because every woman is in a different space. There are some women who are like, I'm good, it doesn't matter. But there are some women who are like, I do have struggles, but the way you just approach that, I'm good on you, right?
I definitely think these talks are like needed because my first talk about having a child was actually I was at Camp Kudzu, and when we became teens, we started having our teen talks. So they would take us in the room, and everybody teens ask questions. So we get to ask all our counselors. We got doctors up there, counselors who are diabetics too, and that was really good for us. And we talked about like, hey, what is it like? Can we get pregnant? X, Y, and Z. But that was the time. Remember earlier we were talking about how the doc. That's what I was saying. It's a time and a place. You read the room. But even then, they kind of scared us with some of the facts they were telling us back then. They were just giving us facts and telling us different things. But what helped me as I got older was seeing those same friends I was in that class with, pregnant, married, had babies. So that helped me, and I was like, woo, well, if they can do it, I could probably do it. I mean, I ain't tried yet. But I think that helped me, just seeing that these are the same girls. We were all asking the exact same questions. Yeah. And they end up having babies. Some did have complications, some did not. So I don't know. I think it's just a certain amount of fear we got to let ourselves take in.
It's definitely a personal experience because I didn't have a Camp Kudzu. I mean, it was around. I didn't know about it. I didn't go to it. I didn't have anybody explain to me and I got it when I was 11. Like she got it when she was 10. But like the implications of diabetes on pregnancy and fertility. And so my teenage years, I'm trying to be a regular teenage girl. I'm not really managing my diabetes like I should because I was hiding it. I wasn't comfortable in my own skin. And so now that I do, and I've said this publicly, but now that I do experience issues with infertility, I'm like, well, dang, if I had done better then, maybe this wouldn't have happened to me. But I know my husband wants we have a son, but I didn't birth him. I want to give my husband a child. He wants a daughter. Give my husband a child.
Okay, girl, dad.
Real bad. My son wants a sibling. So it's like,
and you want
I don't want a baby too, but it's like, can I get pregnant? I can't give it to them when they want it. When I get pregnant, am I going to have issues? Like you said, seeing somebody do it successfully does help. So like Kiva and seeing her little girl, you got your, you know what I mean? Like those things help, but there is still this fear of being pregnant.
Yeah.
And with my particular condition, I may have to use a donor egg. So then I'm like, well, do I want to take that risk with the donor egg? Like, if it's not going to even be my own genes, do I want to take that risk of being, I'll be 38 this year, diabetic. I know. But yeah, it's a lot. It's a lot to really, and thank God I have a supportive partner. Everybody doesn't have that.
Yeah.
So
I think
they walked us through a lot of stuff as a kid, though. They told us like that the blood sugars, how it can like fluctuate even more. I don't remember every single piece of it, but I remember as a kid, I was really thankful because that was the questions I had asked. And I'm not about to have a baby because I was diagnosed at 9. I went to camp, I think 10 or 11. So yeah, these are good questions. And I finally, I think they waited until I was like 14 or 15 to this teen talk. I was like, okay, I made it to the teen talk. But I don't remember all the questions, but I think it's good to talk to teens around that time about the topic if they are a diabetic because it opens you up to like what really could happen. And again, they weren't giving opinions; they were giving just straight facts, and that was helpful for us.
But again, you ain't think about that. I'm trying to figure out what this boy that I'm going to class with,
or if I'm a mate team,
like, do she like me? Do he like I'm not?
Or if I'm a mate basketball team, like that kind of stuff. And I think there's a little moment here that actually stood out to me because as you were talking, you were like, my husband wants a girl, my son wants a sibling, and you said, oh, and you want it, and she's like, oh yeah, me too. But there is an important piece there because very early, and I would say in my 20s, I got very comfortable with the fact that I may never have kids. Not saying I didn't want them, but I was saying if this didn't happen, I may be okay if it's because of me. But when you bring somebody else into the picture who wants a family, who wants kids, that actually does start to bring some type of pressure. And it has an emotional toll on itself, right? Because it's like, well, I want to be able to create that for them. right? So it's not the meaning that I don't.
That's why I said it.
So I think there's a reality there too. There's a reality that some people are struggling with. And Portia, you and I have had this conversation. So I am like, it's a real thing because it's like it's no longer just a you thing because you've come to realize I've weighed out my options for myself. Yeah. I've understood what it can mean for me, but there is someone else in here that I care about and I want to give it to them. So it's sometimes, and I would say for me, it actually is less about what I do for me and what I want, but it's really about me wanting to do that for my partner, my person, someone I love. And I think that's the hardest thing because it's like, just as much as I chose them, they chose me. Mm-hmm. And what if I I'm optimistic that I will, like, I want to do this, but what if I can't? What if I don't? What
and that's why I think it's good to have friends like this, right, who gives you that grace. And that's why I was listening deeply to your words. That's why I was like, I was waiting on you to say, I want this. And I didn't hear this. So I was like, you want it too, right? But I think, I think the good thing about these conversations is, and that's why you got to kind of always, I'm not married, nowhere near, not even in a serious relationship. But you gotta remember you come first, and that you can only do so much, especially if you're already trying, right?
Yeah, and it's not. And I hear what you're saying. I'm not. It's not to say that I or Portia, we're not putting ourselves first in this, but it's just really it's different. It's different when you have someone else, you care about them, they're choosing you, right? And like I always share with Portia. I've always had this thing where I grapple myself, like I already felt like a broken toy, but now I'm like, I feel like a broken woman. You know what I mean? Mm-hmm. And is it because I'm diabetic? Is it because of something else? But it's like now I'm bringing this into my relationship. I want to be able to give this because for all I know, like they may not be the reason for this. Like I want to give this to them. They're still choosing me. Will they continue to choose me? They've not given me a reason they won't, but that's that fear again. Like, will you still choose me if I can't? I will be optimistic. I will wear a happy face and I will try. But what if it doesn't? Like,
right?
Will the fears come back, right? And then I have to mentally navigate this. And then if we stay together 10, 15, 20 years later, will there be a regret that like I stayed with her, I chose her, but I didn't get this? And that is something that we have to grapple with, but we also have to grapple with that with our person because they're going through that with us.
With you.
And we have to acknowledge where they are too because it's sensitive for us. So even having that conversation can be a lot for them to even approach that. Like I recognize she's like, this is hard for her. I don't want to trigger her anymore by having this, but it also means a lot to me. Yeah. And it's hard for me because I know what I want and I may have to sacrifice something that I truly also want because I really love and want to stick with this woman. So it's a lot. Yeah. Right. And it's
sound like married.
And with my personality, I'm very much a problem solver.
Virgo queen.
Like both of us, right? Same birthday, same sound. Like we are very similar, right? So it's like if I want something, I can pretty much know if I do A, B, and C, I can go after it and get it, right? I can make if that don't work, I can do X, Y, and Z. But at some point, I'm gonna get it or I'm gonna fix it or you know what I mean? And this is something I can't fix. I can't fix. I don't know when I'll get pregnant, if I'll get pregnant. I don't know any of that. And so that also just bothers me just because of like who I am.
Vulnerability. You have to be vulnerable to the universe. So
God been teaching me my whole life. You ain't got no control, right? Like, I'm like, dang this. So it's like, you gave me diabetes. Okay. I figured out how to navigate that journey. Okay. Well, then you gave me another diagnosis. I'm sure there's a reason for it. Like out of diabetes came diabetes in the eye. So maybe there's going to be some kind of testimony to this situation too. But to your point, it does help to have people that are like, that understand, that are going through it. That creating a family, and then people ask all the time, "Oh my God, you and Kenny look so cute. I love y'all. When you having a baby?" I got a son. He's 12. Yeah. When you having yours? He is mine. Like, stop asking.
You have to keep reassuring the people around you, like, I'm good, while reassuring yourself, I'm good.
Yeah, my answer is whenever the Lord is ready. That's literally whenever the Lord is ready.
Yeah, and to your point, like you're right. Seeing other women, it does make you feel good. But I'll be honest, I'm being very honest, there's also a part of you just like, when is it going to be I have my moment? When is it going to be my moment?
Correct.
So it doesn't mean I'm less happy for you. I'm ecstatic for you. And I want you to like share everything. But it's also like, ooh, I want that for me one day too. Right? And like, especially if your partner sees that too, like they're like, Yes, because I you know, and to the point where like my mom will even ask like, okay, are you okay? I know you're happy, but how are you feeling? I'm like, I'm okay. And again, because it's because you're balancing two things, right? You're ecstatic for someone to see that they can and have a baby. That's great, and you want that to continue to happen if that's what they want. But you're also like, I hope I get that. I really, really hope I get that, right?
That's what I was trying to touch on. Like, again, it won't solve everything, right? Us having our girl talks won't solve everything, but it does help.
Oh,
it does feel like a
It
piece of
does.
you, and like a piece of you feel like, oh, I see myself in this other female. I see myself going through this, or this person gave me hope today. You know, so I think these conversations,
they're necessary.
They're necessary, and of course you're gonna have it with your man. That's your
But
rock.
it's not the same.
But these are, I just feel like it's needed because it may bring a little bit of hope and joy, and at the exact same time, even if it's not hope and joy, the gloomy, we can be gloomy together. You know, ice cream, crying together. You know,
I like the reality of the devastation.
Yeah,
if that makes sense. Like, because I mean, if you go through this walk by yourself, like how we mentioned earlier in the conversation, a lot of this stuff is internal. And if I can look and at the community, everybody looks good. But internally, what are we going through? Like mentally, emotionally, how is this working out? But if we don't discuss the bad with the good, how do you really know how to navigate the journey?
Yeah, and I have to be very mindful around language. So I've always been like, language is power. So this is not to criticize or knock anything, but instead of like the bad, like the reality, right? It's not good or bad, it's just the reality that we're navigating, right? Because if we have a child, great, that's good. If we don't, that's okay. It's not bad. It's the reality, right? It's a different reality. So like being very cautious because like, and I do this for me, my own mental health, because there are studies that show that like you are, I think it's 30% more likely to deal with mental health issues when you have a chronic illness, just because of all the emotions it kind of brings with you. So that's why good physicians couple you with some type of like therapy or something, right? With that, I didn't get that when I was going through. I wish I got that very much earlier on in my journey, but there's a mental health component to it, and so now that I'm at an age where I'm like really like owning my diabetes more than it owns me, being very thoughtful around how I frame it. So if someone says, I feel sorry for you, I'm doing okay.
Right.
Like, don't get me wrong, come to these challenges, but like, I'm not, you know, I'm still here, I'm kicking. So like being very mindful, like how we carry our mindset. That's why I said like, even the fear thing, like it takes mental work, because I'm someone, if I stub my toe, I'm losing it, guys.
Oh Lord,
it's gone. That's neuropathy right there. But so like I gotta still work at it, right? But I think that is something that like when you acknowledge and you like, okay, I'm not going to be like, because then you can kind of get stuck in this swirl of it all, you know.
I have a question. Are you guys as open with your diabetes at work as you are like amongst your social groups?
No,
I am.
Not at all.
Well, no, I'm not. Well, let me be honest. I'm not as open with a lot of things at work because I get paid to talk to you. So I'm very mindful about how much I share at work versus like, we got to get this done and let's just, you know, the weather is nice. You know, what are we talking about today? But I don't hide it either. So like every manager I've worked for knows I'm diabetic. You need to know that. Why wouldn't you know that? Like I'm diabetic.
That's mine.
I got this event coming up. Y'all coming?
Yeah.
Y'all want a shirt? Y'all want a hoodie? Like I'm open.
I'm not at work. I'll be transparent. Like I gotta balance. Remember I said I'm very open. Like when I date my family, my friends. But at work, no, it's straight business. You don't need to know anything about my health.
But see, you know why? Do you want me to tell you why? One reason why I don't know why I did this or not. So when I remember I was 21 years old. I was in college, and we were in this session, and they were like, "Raise your hand if you have a disability." First of all, I don't have the word disability. It's different because this means you cannot. That's why language matters. Different means I do it differently, but I'm still able.
I'll take disability as a, you can label me that when it comes to applying for a federal job or when it's time to go to the airport. I'll take those benefits there.
But they were like, raise your hand if you got disability. And so I'm sitting here like, la, 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 not me. And then they flash on the screen. I'm like, excuse me, there's a mistake. Diabetes is not a disability. They were like, do you ever have to stop if you're in the middle of an exam because you have a low? I was like, yep, yes. They were like, have your blood sugars ever impeded your ability to do something? Yes, you don't know my life. And like, they were reading me in front of the entire group. And they were like, you do have a disability. Like, it's okay, right? And I started, like, I had to come to grapples with that because in my mind, I was like, I'm not different. As Portia said, when you start at a young age, real young age, you know, like, I'm not different, but you are. Yeah. And so, to your point, at work, there are accommodations sometimes. I work in the HR space, and so it's important to know. I've never had to, ring that bell, but it's important to know, like, hey, if I can't join a meeting right now, I'm low. I need some sugar. Or like, I was on a call on Friday. Okay, I can't process what y'all saying. I need some sugar right now. Like, manager, I got to call you in 10 minutes. So it is important, I think, for at least a minimum for all my managers to know. It doesn't mean that everyone I work with, there are certain people who may know as well, but I do think it's really important to make sure that your direct manager that you have to engage with is at least aware of that.
And it could depend on who you work with. Like my team, they laugh all the time, but they're like, we got snacks in the drawer. They call me Pete. Like, if you need something, just go to my desk. It's in my drawer. Like, they keep snacks around for me. So I think it depends on who you work with too.
That's true.
What the culture is, what the environment is.
Is there a particular reason that you don't?
Yeah. There's a few. I mean, when I was working at my first job, I was a manager. I worked at a distribution center. I was the only black woman manager at the Tiara distribution center, and I managed 2 different departments. So the people that knew were the other managers who worked closely with me, but other than that, I didn't really tell. And when I moved up and I got into retail management, I had no choice but to tell because I was on my feet way more. So like, I'm gonna have to go sit down. I had to use those accommodations for that. And then after that, I went directly into corporate. And again, I was the only black female in the entire office. And everyone that I worked with was very older white men. No, I did not feel comfortable. I've been to HR before about some of the things and how I was treated outside of diabetes, just as a woman. So no, I didn't want any type of red flag, any type of extra paying attention care to me. I just wanted to get certain work done and leave, which is why I am much happier now that I work from home. There's no need to tell them at home. If I'm low or I'm not feeling good, I could take me a 10-minute break and then work harder, stay up later. So working from home definitely helps me be able to have my balance. But I don't know. I just think when it comes to me at work, I don't want anyone to look down on me even a slight bit. And I think I'm vulnerable with my friends and family because I'm okay if they do a little bit. Heck, they'll give me extra grace. Yeah. But at work, I don't know. Like, that's my balance. Like, I'm a boss at work. So, like, but when I come home, I can be relaxed.
Yeah, you can still be a boss because you can still be a boss. You can be
but if it really truly needed it to be, I would just blame it on like, hey, I'm not feeling well today. Because to be transparent, the more you get up in corporate, I've learned the less you say, the better. Like, you can say some things like, okay, well, I'm not feeling good right now, or I need a 10-minute break. They're okay with that. You don't have to go in much detail. I used to be much more open when I was younger.
I've worked in corporate my entire career with I've worked C-suite, all that in corporate, and some of them do know I'm diabetic. But I also work in healthcare corporate, so I feel more comfortable. It's like I actually use that in some interviews. That's my reason. That's like why I love healthcare because of my own personal journey. Myself knowing healthcare. But I will say. I'm not gonna. I do have my limitations too because I just got comfortable showing my CGM, like, cause like the cute little shirts and stuff. I'm like, I gotta throw a little sweater. Let me have a little sleeve so I can hide this. So that way, those who don't know don't know. Those who know. So I do understand. So it's like definitely a journey, but you can still be a girl boss because I've been the only black, the only woman, the only all the above. And giving my shots in the middle of a meeting under the table, and you just have to be right next to me and understand this what's happening right now. But I can also understand the environment too. That's always been important to me, though. Is I will leave a manager if they haven't been open. And thankfully, I've been even the ones that haven't been the greatest. I have been able to be open with them about that minimum, and it's worked for me.
Don't like me too much. I can't leave.
So then we've been talking for some time. We probably could talk all day. The intersection of womanhood and diabetes, but. You talk about you just got comfortable showing your CGM.
Yes.
That was me like 3 4-ish years ago, maybe. Wow. Yeah, because diabetes can kind of put some like body image, especially when you get it young and you got to go through your teenage years, right? Like one of the reasons why I think I didn't do well is because my insulin pump, the bulge, didn't look cute with my tight pants or my crop top or whatever it is, right? And so I think I would hide it. I wouldn't, maybe I wouldn't wear it. I might take my syringe and my insulin, but I wouldn't wear it. So then things weren't as controlled. So let's talk about body image and diabetes and kind of.
I actually didn't get a CGM and pump for a while because of it. They kept saying, get a CGM, get the pump. And I was like, I don't really want to show. This was like, I remember this like my 20s, because I had started like the regular MPH days. And when Lantus came, it was like, great, that was a big thing. And then came the pumps and CGM. And I was really subconscious about it, showing I was like, I can't wear the cute dresses. So when I first got a pump, I was and even to this day, I was very much so, I use it less now, but like, you have to still keep my prescription for syringes. You have to, like, I want to be able to take this off. And I remember, and I was sharing this story, I remember one time I was at the beach thinking I was cute, my little bikini. I had my pump hidden, like nobody could see it. But somebody was like, girl, your birth control is showing, and like tried to pull it. And I was like, no, you can see it. Like, it's on my leg. Like, oh no, this is what I was trying to avoid. So there was a time I was even self-conscious to use the devices that actually help, because I didn't want it to be seen in certain clothing. And the scarring doesn't help.
Oh, the scarring does not help.
Yeah. The scarring doesn't
What's
help.
the scarring?
So for me, it's like, so on my CGM, I do the sticker that comes with it, but then I also do an overlay because I'm very active, and so I don't want it to come off while I'm in trampoline class or while I'm playing kickball. And so when it's time to take the sticker off, sometimes it can scar your skin a little bit. It's not like a deep scar where it's like scabbing, but you may say a faint circle where the sticker was, and it doesn't necessarily go away.
So that's what I'm experiencing.
So
That's what but I see when I have my bikinis on, I'll make sure I'm all oiled up so they won't be ashy. But you can see the scarring from where
it used to be.
Yeah, you can see it. And then it's sometimes even because I took shots a lot when I was younger.
Yeah.
So then you get scar tissue from taking shots, so many shots. And it's like, I can have a flat stomach every place else, but then these two little pockets where I was taking shots at when I was younger, they may not go away. So it just it made me kind of self-conscious for a little while too, in terms of like wearing a bikini, showing my devices, wearing tight dresses. And sometimes I'm like,
yeah, I definitely say
I took my stuff off one time and I'm just like, I'm in the shower, like exfoliation gloves and everything.
No, you got to use a particular wipe.
I don't know what's
It may not go away.
It may not go away
over time.
If my mama didn't perm my hair, I wouldn't have scar tissue. I'm joking, but like, but for mine, it's not even just the
overlay.
The overlay. I actually get it in the spot where the
Yeah.
tubing is. I get it there.
syringe, me too.
So wherever it goes without fail, wherever there is, like, it's inserted, when I pull it out,
It's gonna be
it's red, purple there, and it just stays there. So I do mine in my legs right now. All this, because I just started back on the pump in December. So this was like beautiful one-tone thigh meat. Now
It
got 3 or 4 different colors. You get green, purple, red.
Something else I want to mention is maybe we could highlight on it gaining weight after diabetes as well, because we talked about body image, but like that is a big thing. So I started off, I was diagnosed when I was 9, and I came in the hospital, I was real skinny. They couldn't even pinch anything to give me a shot. That's how skinny I was. But then as you get older, you start, but now your body is like, oh, you're healthy now. So now you started gaining weight a bit faster. And good thing I worked out. But for a lot of my friends, I still felt insecure that now I came from being this small to now I'm getting thick.
Insulin puts on weight.
And that's the point. Insulin puts on weight. And now you're being healthy as well.
You want the weight.
Yeah,
all right. Well, I used to want the weight too. And so now I'll be 38 this year. So then you got diabetes weight gain. You got middle-aged woman weight gain. And I'm talking about that. I work out, I eat good. And I'm like, this weight is not going anywhere. And it's like, I'm harder on my husband. Is like, girl, you're fine. But I'm so hard on myself because I know
yourself a certain way.
I do. And that's just, I mean, I need to change that in general, right? But yeah, I'm used to having this lean, in-tone, athletic body. And so I think I'm coming to terms with, you 37, plus you got diabetes. Like, you just got to do the best you can. Sis. But it does make you think about it. Like, it really does.
Touching on what you said about the insecurities, I'm on the opposite scale. So before, like, of course, it took me a while to lose the pregnancy weight, like a long time. So, like, when my sister-in-law, my friends would be like, girl, you losing weight. I was like, you weight. But then, like, after I got diagnosed and then, like, the whole DKA experience, they be like, girl, you losing weight. I was like, what's my A1C? Now I'm scared. Like,
yeah, because that's
that
was a sign.
So I don't want to hear that no more.
Yeah,
I'm good on that.
You say that until you gain, and you're like, well, I'll hear it a little bit.
I'd rather gain than be as frail as
I
I was because I
understand.
looked like I was on something. Like,
And you don't even realize how skinny you are until you go back to the pictures.
Yes.
You be like, oh, that was my arm.
I couldn't use
Shit, that was my
none
shit, that was
of
my wrist. That was my arm.
That was the whole arm.
I didn't post none of my engagement photos because I was so like,
oh no,
sunken. It was a nasty look. But I couldn't see it.
Yeah,
you know, I'm day to day me. But like looking back at them pictures, I'd be like, so nobody said nothing. Like y'all saw me deteriorating before your eyes, and nobody said nothing.
But it's an image in America to being skinny and thin, so it's kind of harder, especially as a kid. Like you're already small kids; they're just normal or whatever. But and then the image of everyone needing to be small and petite on top of that. It's a bit hard, especially people around you just to notice. They may think you looking good.
Girl,
you
no,
skinny,
like you
but,
could see my actual bones.
Yeah, that's,
like it
but
was.
you see the
nasty.
people on the galas.
Oh.
And stuff, showing off their little-
That's true. That's true.
I can't.
I will say this though. More so, this is about being small, but in other places. So when we talk about like devices, and none of y'all probably have had this issue, just looking across. But like even with devices, so we talked about like having dresses and stuff like that, and how to hide them. And now I'm at a point now where I'll put it on whatever. But I remember the doctor was like, "Oh, put it in your bra," and I was like, "Do you not see? Like this ain't gonna hide nothing, okay? It's gonna show a little bit of a bulge. I need you to."
I never thought of that.
That's why when I had the Moby. Now when I got it, I was like, "What is the size? Like size matters to me.
Size matters in life.
The second pause.
Size matters to me because when I pull it out, no, because I don't have any places to like hide it if I have, and it's not even sometimes now about being like cognizant of who can see, who can't. It's like I don't want to mess my outfit up.
Yeah,
it's like a certain dress. It's like, but thankfully the Moby is small. The Omnipod is just kind of a patch on there. But that was important because my first pump was a Medtronic. I was like, okay, how can I stick it in my bra so that way it can on this dress? Okay, well, it's not going to work. So I think, as women, because of our clothing, like you said, the crop tops, the bikini, the tights.
It shows you, like, we have to be, on top of being a woman, we have to be more mindful of what we wear because we're a diabetic, because we wear all these things on us. Definitely. So let's add that to the list.
Yeah, and if you're talking about if you date someone, what if you meet someone at the beach? Well, I mean, you exposed, you out now. So, I mean, the good thing is he know what he's getting. So he know you
But sometimes men are dense. They may not even notice it. They just see your pretty face.
Yes, that is happening.
And they'll ask about it later on the second time. Oh, I seen that the first time, but I ain't think to ask about it. But the second time.
That's funny because, I mean, I guess this is personal, but like my husband would like for me to sleep with nothing.
Girl.
Like, and I'm
It
like,
don't matter to him. I can matter to me.
I can't really do that. I gotta at least have something to clip something on.
No. I'm telling you, you don't need the clip.
Pillow.
You don't need the clip.
Oh, I'm afraid like the way I sleep, I don't want it to roll over and it pulls out.
Yeah.
Or like I need to know where
Is
it
your
is.
string short? Well,
I have the long one.
Excuse me.
I have the long one.
Listen, I'm telling you, Portia, just because same. Okay. Find that little thing, find a place for it to prop.
But I can't toss
I toss and turn too.
Yeah.
But the long tubing helps. I toss and turn too. But I'm telling you, because I get a lot of.
Sounds like it can be done.
It can be
But
done.
then if it's on the side where he's sleeping, so if it's on this side and he lays next to me, what do you do?
Okay, so if he's here, we're doing visuals, y'all, now.
Yeah, because I need to know.
So if he's here, he has his side, right? If I'm here, and then I have it propped right here, I even have a nightstand sometimes if it stretches over, but I don't need a nightstand. I just put it next to my head on the bed. I lay down, go to sleep in the morning. When I wake up, scooch, you know, the little scooch, right? The pump is still there. If I rolled over, it's still next to me. It's fine. If he wants to feel, okay, maybe he feels the inside, maybe he doesn't. He's cautious, but it's fine.
So it goes across your body?
No, it doesn't.
It wraps
I
around?
take mine with me.
Oh, shoot.
Like if I turn to the left, come on, turn to the left, like a little
Yeah,
pillow.
like
Sleep.
yeah,
I
act like
don't
it's
do
a
all that.
It
yeah.
doesn't pull out when you
perfect.
sleep. When you're asleep, it
Act
doesn't
like it's
pull
your
out.
pillow.
You're fine.
Mhm.
Like it doesn't. Like
Sleep
I just
naked.
have it. I freak out.
Give it a
Y'all
night.
know
Go for it.
Listen, Kenny, we rooting for you, Kenny. You be in the nude, okay? You can.
Okay.
It can work.
I'm
It
going to
can
try that
work.
because
Try it.
I'm like.
I will say,
there's-
don't use your. Well, I don't have my clip on because it makes it less
Yeah, I never
heavy
put
when I
nothing
sleep
on.
on it. Sleep
Yeah.
with it. So just like take
Take
it
the
out
clip off,
there.
take the clip off.
Let it be naked. Let you be naked, and just enjoy.
I would say, going back to the subject matter of the body image, I guess, okay, so prior to, because I was already married, so all of this stuff was new. So I got the beforehand and the afterhand. Beforehand, I'm always sending 5 attachments like, you know, you about to get it when you get home. After the diagnosis, I was just like, now I'm wearing all the stuff. I'm like, I'm taking my 5 attachments, but I don't send them no more because I didn't feel sexy no more.
And I told
But after scrolling through social media and I saw this beautiful black girl, her name was Kiva, and then I seen how she was wearing it and dipping it and doing it, I was like, so I too can still be great.
Yes.
And then I took my 5 attachment pictures again. I was like, and he liked it. I was like, okay.
Yeah.
So,
It's
but
something
that
about
really helped.
confidence.
I'm gonna
y'all.
tell you
Yes.
something. It is because
That's-
we care
yeah.
more than men do. I'm gonna tell you because
We do.
I can come down, like have my sensor. My husband does not care. He's like, no one's looking at that. Do you
Yes.
see you have booty in my
Yes.
face? Like, why am I why do you think I'm thinking
A
about this?
naked woman in front of a man
All
shouldn't
the
care about
options in
any
front of me.
devices.
Why do you
Right.
think that's where my eyes went? Like I literally, like my eye, and like you said,
But
it's
we're
the
comfortable
confidence.
with that person,
It's the
so we're gonna
confidence.
tell them. But it does. You know, we're gonna tell them, well, don't look at this, and I don't want to look at anywhere near there. But okay.
I think that's
So
a woman
look at
thing in
this.
general, though.
Yeah.
Yeah.
Womanhood and diabetes. Perfect transition, right? So I have noticed that when I guess the stage before I actually got diagnosed, like she wasn't working like how she was supposed to be working. I was trying to figure out, is it that I'm not attracted to him anymore? Is I got too much stuff on my brain? Is it because like I got kids and I don't want them to walk in? Like what is going on to where this ain't doing what it need to do? But once I got diagnosed and I started like on the pump to where everything was starting to be regulated, when I say it came back on, I was just like, she's not gonna die. We're gonna keep her husband. That's what I'm talking about.
But I do
But
think it's a correlation.
it
Yes,
definitely
your body
is.
works. Your body's
It
working.
is.
I ain't never discussed this with a doctor, but I think there is a big correlation.
Yes, ma'am, it
There
is.
is.
It very
Right.
much. Yes.
UTIs.
Oh yeah,
You
you
definitely
know
get
we're more
more
prone for
prone to
yeast
infections.
infections.
All that. If
Yeah,
your
we're
sugar's
more
out
prone
of
for that.
control. All of that.
Yeah.
Whenever
Like, at
my
this
blood sugar was like
point-
really, really high, it was like, oh, you back? I'm sorry.
Listen, the way they give us and keep us on the different types of insulin, as a woman, we should have that same access to diflucan or metronidazole.
But you know what? It's actually bad for your liver if you take too much of it.
Really?
Yeah, diflucan if you take too much of it. Because I had a doctor who we were talking about, and it was an ear, nose, throat. So this is it because we can also get thrush, right? I didn't have it, but we were talking about it. But being prone for yeast too. It's like if you take too much diflucan, because sometimes they'll use that over and over, it can cause liver damage. So I've seen that.
Good to know.
So I started asking
didn't
questions.
know
I
that
was like,
either.
so what you mean by like over time? Like describe this, because you're right. We do
Yeah.
have higher,
Chances.
we're higher risk. Yeah. So I mean, pH is important for any woman, but especially for
For a
us,
diabetic.
because like you said, 3 or 4 days of highs, you're like, okay, I know
Why my
I
side
listen.
hurt?
Yeah, I know why
With
this is
cranberry
here.
juice.
I know somebody out there watching. If you just eat right,
Yeah.
it'll
not
go
quite.
away. I'm just
Yeah,
like, if
no,
you
and
don't
some of
work
it's
like
just
that.
the nature of just. I mean, here's the thing: being a woman and diabetic, you do have higher risk of so many different things. So we talked about pregnancy. We're talking about, vaginal issues, but also, did y'all even know carpal tunnel was higher risk for women with diabetes? No. Yeah, so I went to the doctor to get tested for carpal tunnel, and the symptoms were like female, diabetic, female while pregnant. Like, dang, this is like, oh, it's just, that's just, but we're higher risk for a lot of things. So like how we take care of our body. I mean, we talk about the mental toll, right? It's like everything's like, this is another thing I got to worry about. But it's like, I would say for me, when I was younger, I was scared because of what would happen at the end of diabetes. So like, okay, I'm going to lose a leg, I'm going to be blind, I'm going to lose my kidneys, all this stuff. That's how people talk about it with you. And then when you get older, you keep hearing about this and this and this and this. And you're like, dang, I got to worry about this too. So.
Frozen shoulder.
Yes.
Never heard of it until I got it.
What was that?
And I've had it too.
So frozen shoulder is basically when your body creates this scar tissue around your shoulder capsule so you can't move it. And women with endocrine issues and middle-aged women or with hormonal issues are more likely to get it. Sorry. I'm 2 for 2.
Is it because you shoot in your shoulder or something?
No. They don't know what causes it. It's just correlated to
diabetes.
Women with endocrine issues. Diabetes is an endocrine issue, plus I had the reproductive issues too. So I've had it in my left shoulder. There's no timeline on it. So you just kind of that's why I said the Lord be teaching me all about control because I can't control frozen shoulder. Yeah, it happens in a lot of diabetics. So I had it in my left shoulder. It resolved itself after years. Had it in my right shoulder. Had surgery because it was so bad. And I still don't have full motion in my shoulder. But I look at these scars and I'm like, hey, I have it because diabetes too, maybe. Right? And it's not a complication. It just happens in women with endocrine issues. But never, to your point, never knew about it.
Yeah.
Until
I didn't know about carpal tunnel
I was like,
I was like,
I'm sorry, I want to go back to this topic. So once you got it regulated,
are we going back to okay?
You gotta ask me questions. Then you seem like more in like yourself wanting to engage in that, or like more.
It was
like
more pleasurable to do it. I mean, I have a high sex drive. But, like, the desire to want to do it, like, it was like, oh, my God. It felt more like a chore because I know I wasn't operating at a game level or whatever. But, like, afterwards, I was like, all right, come on. Like, I got the A game level, you know.
I just thought
the libido is definitely affected by it. Yeah.
So, to wrap this all up, we talked about a number of things. Dating, relationships, pregnancy. But to end this, if there was one thing you had to tell a woman living with diabetes, what would it be?
Be bold, be bad, be beautiful. Because, I mean, at the end of the day, like, there's a lot that comes with this. We talk about the scarring and, like, being comfortable with our devices and all these different things. But we still baddies. You're still beautiful. Don't be ashamed to show your journey, whether it's through your devices or in your conversations. As long as you're not leading with fear and your insecurities, there's no reason. We, like to your point, like we hold more of that than sometimes people around us. And if we don't make it a thing, sometimes people don't make it a thing. It's not a thing. So just kind of be bold, and it's okay to have the find community. Also, you
can't take all the gems out. You started with one gem. You said that's our last one. I said
I'm done. Okay, find community. Then I'm done. It's just
I'm mad because that was mine.
Okay, my bad.
But you can touch on it a bit more.
Okay, I'm gonna keep it short. Virgo Queen, we just.
I know.
But I would say, just for me personally, it has made such a difference, even in how I embrace it, how I navigate. Like, I've only had community for a sliver of the time that I've had this, and I see a difference in myself than I have even throughout the majority of this journey. So I'm gonna stop because Portia got all the gems to add to that.
No, I wanted to add that, like, finding community is so important. But you said something like a sisterhood, right? And so I think, in community you can have male or female that live with diabetes, and you can have some of the same experiences. But to be a woman and have the same experiences, to be a Black woman and have the same experiences, it's just I can't even explain it honestly. I would not, diabetes in the odds would not have probably happened, let's say as soon, maybe, if it wasn't for finding a community that helped me kind of like blossom and be out there with it. And
my advice would be take your time, process it first, because it is the new reality. Take ownership of it, and then take it serious, because I know some people who are pre-diabetic, and I could say, I wish I could go back to that stage if that was a stage, and they just doing whatever. And I'm like, you don't want to come over here to where it's permanent. You still got options, but take it seriously, get ahead of it, but you can still live your life bold, vicariously, sexy, beautiful, all of that. Just be empowered with it. It is not a plague. Don't let it slow you down. And if it does, it's okay. Get back up.
Yeah.
For me, if I had to really speak to any woman with diabetes, it would be to give yourself grace. Don't forget to take care of you while taking care of others. And know that every day you're not supposed to be perfect. The goal isn't to be perfect. Although we know that's our personal goal, the goal is just to enjoy this life that we're living as best as we can. So definitely, this is something I have to tell myself all the time. Give myself grace. And don't forget you have diabetes, because there are times where I genuinely forget and I just go on autopilot. And until I get back to groups like this, I'm like, oh, yeah, I do have it. Oh, yeah, I do have diabetes. It is a Monday. I guess, and make a joke out of it every once in a while. You're going to have it. Might as well joke about it.
For sure.
And use it to your advantage if you can. Because, I can't go to that meeting. I'm low. My bad. Y'all enjoy.
Yes, that part. I stay on FMLA just in case I got to feel like coming in today.
Well, it's a wrap, y'all. Did y'all have fun today?
Yeah.
I enjoyed the conversation for sure. That is your Sweet Tea Dialogues, the intersection of womanhood and diabetes, in honor of Women's History Month. I appreciate y'all.
Thank you.
Thank you.